And this is Mountain Health Minutes, brought to you by the Tahoe Forest Health System. I'm Ted Owens, your host, and with me today is Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. Dr. Evans, how are you?
I'm good, Ted. Thank you.
Let's talk a little bit about lab testing, particularly in the winter. Why is lab testing important? Do patients need a referral from a physician to get lab draws done and find out what's going on with their systems? Tell us a little bit about the procedure and why it's important.
Yeah, generally speaking, it's the first step is to connect with your primary provider to be evaluated because lab testing is helpful, but it's really helpful in the context of your overall evaluation, what's going on with any symptoms, physical examination, et cetera. So laboratory testing is it's an important part of screening for diseases. And so it is very common to receive lab test orders from your provider on a regular basis, and that becomes more important as we age. So my recommendation is that everybody have a primary care provider and check in with them on a regular basis, and certainly follow the instructions of getting laboratory tests as indicated. And labs can pick up a lot of different diseases and things that require some attention.
That's where I was going to go. What will your primary care physician see in the lab test results? What would be typical for them to look for?
Well, there's many different things that can be screened for with laboratory testing. Certainly the way that our organs are functioning, like our liver, how well our liver is doing, how well our kidneys are functioning, all of our electrolytes. Blood counts are very important to kind of get a sense of, are we anemic? Do we have the right number of red blood cells and white blood cells? Gives us an idea of our immune state. We certainly check for blood sugar, make sure that we're not showing any signs of diabetes developing. And there's obviously many of us are going to end up getting a lipid panel, which checks for cholesterol to give us an idea of risk for heart disease, cerebrovascular disease, and other things. So definitely a key part of our overall wellness.
You had mentioned anemia. So, where does a vitamin D deficiency fit into our health in the winter months?
Well, vitamin D deficiency is actually quite common, and so it's one of the things that physicians screen for on a regular basis. And sometimes people will have vitamin D deficiency, not even know it. Symptoms often will be things like, fatigue and achiness, sometimes a depressed mood. And so those types of things are very common and might warrant a vitamin D level to see if folks are getting low.
Very good. Dr. Evans, thank you so much for making the time to be with us and share some wonderful information. This is Mountain Health Minutes, brought to you by the Tahoe Forest Health System. Thank you very much for tuning in.